All right. So just a quick review over the lymph of the. Let me move to the other application. So let's do it. So to go over the lymphatics of the pelvis, so there are the major lymphatic, let's say, lymph nodes to talk about. First of all, the one that you know from before. So basically, we said that every lymph node group, they are located around the vessels of the same name. So if here you're looking at the external iliac and here you're looking at the internal iliac artery and vein running together, so around them you've got external iliac and internal iliac lymph nodes. So external iliac lymph nodes, they receive the lymph basically from inguinal lymph nodes, which inguinal lymph nodes were receiving the lymph from the rest of the lower limb. Like, it's just something from last year. Then internal iliac lymph nodes, so you know that the area that the internal iliac vessels are supplying the blood, so once the venous blood is also coming back, so the lymph is also coming back in the same manner. So whatever internal iliac artery supplies, or any other region, so the lymph from that region comes back to the internal iliac lymph nodes. The third group are going to be these guys, which are the sacral lymph nodes, which are located anterior to the sacrum. So it means that sacral lymph nodes, they receive the lymph from the more of posterior structures of the pelvis, or let's say pelvic organs. So all these three groups, all these guys, their lymph is running toward common iliac lymph nodes. All right? And rest of the story is going to be pretty much the same as the abdomen. So from the common iliac lymph nodes, you move to the lumbar lymph nodes, and from lumbar lymph nodes, you would form the lumbar lymphatic trunk in the abdomen until you reach to the chyle cistern.
It's visible on the cadaver because I saw it in dissection videos, but I don't think that we saw it on the cadaver. It's visible?
I don't remember seeing it. I don't remember seeing that.
No.
So I don't think so.
So where do you show the location of it?
It's usually on the right side of the aorta, and it's like level of L1, L2. So it would be if you find the superior mesenteric vessels or renal arteries on the right side.
Okay. Okay.
At this, theoretically, you would say that, but I don't think they will ask you to show it.
No, it's a topic to show. Show the lymphatic location of lymphatic
If
drainage
you-
of the intraarterial
Yeah,
and the rectal.
if you make a drawing and then if you just talk about the location, should be good. Yeah. All right then. So that's one thing. Now the innervation of the pelvis, or the nerves that you have in the pelvis. So I wrote them all here. So pelvic nerves would be obturator nerve, which is coming from the lumbar plexus, lumbosacral trunk, which joins the sacral plexus from lumbar plexus, sacral plexus, and coccygeal plexus. So these are the ones. The thing is that this picture is quite familiar to you from last year. So the thing is, here we are looking at the lumbosacral trunk, this guy. So from L4 and L5, you would see it right next to the obturator nerve on the cadaver. So if you imagine that there's gonna be the, let's say, psoas major muscle, for example, this guy is running down. So you're gonna pull away the psoas major muscle toward the lateral side, all right? Then right next to it, you will find the lumbosacral trunk so nicely. And also there is gonna be a nerve which is looking like quite white and so tight. That's gonna be the obturator nerve. So they're gonna be running together, all right? So obturator nerve and lumbosacral trunk, you find both of them on the medial side of psoas major muscle. Okay?
Also the obturator, we can see it go over the canal, no?
Yeah, but still in the upper part of the abdomen, even in the lumbar plexus topic. So you could be, that's the way to show it. Sacral plexus basically is from L4 to S4 levels, all right? So sacral plexus, I I made a tape, or I just copied the table of the book here. So the major branches it gives you. You don't need to know every origination nerve or every origination of every nerve.
You don't need to draw it.
Would be fine. Like sacral plexus, like the main nerve is gonna be the sciatic, L4 to S3. If you remember,
No.
we had posterior cutaneous nerve of the thigh, S2, S3, which were running together toward the, let's say, gluteal region and downward. Then what else? You had pudendal nerve, S2 to S4, like a really important one. Check it up here. Here, this guy, you see that this is gonna be the pudendal nerve here. So this one,
S4.
this one, and this one. So you form the pudendal nerve like this, these three, running down. So from the pelvic cavity, we would run to the gluteal region through the greater sciatic foramen over here. Then you would come back to the perineum, which is the region down here, through the lesser sciatic foramen.
What do you mean by coming back?
So pudendal nerve, its function is to give the main nerve supply to the, let's say, external genital organs and perineal muscles. So first you're in the pelvic cavity, then pudendal nerve passes through the greater sciatic foramen to the gluteal region. If you remember, in the gluteal region, like they were showing you, yeah, exactly. So on the most medial side, you would have the pudendal nerve and vessels with internal pudendal vessels. Without giving any branch, they were just passing through the gluteal region, so at that point back there. And then they were passing through the lesser sciatic foramen over obturator internus and getting their way to the perineum. Okay? So obturator, pudendal nerve is a really important one here.
They don't go through obturator canal.
No. They have their own canal, which we talk about it today.
Alcox.
Yeah. So that's the one, yeah.
Okay.
The other nerves which you could talk about in theory would be nerve to quadratus femoris muscle and obturator internus, which you don't see them, so you just say it. So that's pretty much about the sacral plexus. Coccygeal plexus you have, which is originating from, we can say, S4 or S5 and coccygeal nerve. Okay, so this guy here. So coccygeal plexus, so how many coccygeal nerves you have? On each side you have one
So
only.
it's one pair.
Yeah, pair of coccygeal nerves you have, and that's it. So coccygeal plexus is mainly responsible to supply the skin around the anal region, and also you would have some nerves arising toward the levator ani muscle and coccygeus muscle. All right, so that's mainly from the coccygeal plexus. That's pretty much. So this was the somatic part of the game, let's say. So we have the autonomic part of it. So the major plexus of the nerves, which we will talk about it in the case of the autonomic innervation, is the inferior hypogastric plexus. So we talked about this guy a bit before. So if you remember, you had the lumbar segment of the sympathetic trunk in the abdomen, in the lower abdomen. So then you get lumbar splanchnic nerves, these guys here. Okay? Lumbar splanchnic nerves are presynaptic sympathetic nerves. They reach to the aorta. So here you form the superior hypogastric plexus. Okay? From superior hypogastric plexus, you form left and right hypogastric nerves.
But one of these splanchnic nerves is like the least.
No, these are lumbar splanchnic.
Lumbar.
Yeah, least
Right,
was
right,
thoracic.
Do they like the synapse in the inferior mesenteric ganglion and then they go to the
No.
inferior?
They can synapse anywhere.
True.
Because, check it up, if you have a plexus here, certainly you don't have to have a ganglion.
So like they bypass them and go direct to the superior hypogastric.
Superior hypogastric plexus, which is at the bifurcation of the aorta. So again, any nerve fiber you see at the bifurcation of the aorta, that's superior hypogastric plexus. Then you will have left and right hypogastric nerves, formed by this plexus,
What's it called? Hypogastric.
hypogastric nerves, right and left.
Right and left hypogastric
Yeah.
plexus.
They are running, no, superior hypogastric plexus,
Superior hypogastric.
and right and left hypogastric nerves.
Okay.
So these guys, they're running along common iliac vessels, making their way down to the pelvis at each side of the rectum. So let's say the rectum would be here like that, and then you would have the anal canal. So lateral to the rectum, you have these hypogastric nerves, they form inferior hypogastric plexus, which is a major guy for you.
So we're going from L1, 2, and 3, right?
Yeah, so the origination of these guys would be L1 to L3. Why? Because L3 is the inferior limit of the sympathetic nerves, like their cell bodies. Okay? So the story of the abdomen or the story of the pelvis is like the head and neck. In the head and neck, you had the thoracic segments to give you the sympathetic nerves, then they were traveling up to the neck.
Same splanchnic.
It's the same. It wasn't splanchnic in the case of the head and neck.
Okay.
It was just by the sympathetic trunk. Here, it's pretty much the same. So, the inferior limit is the lumbar region, L3, but the nerves are making their way down to the pelvis. Okay? So, that's pretty much. Still,
And in both cases, they are presynaptic because
all of them are presynaptic. And then here also, there will be some other nerves joining with the inferior hypogastric plexus, sympathetic nerves, still presynaptic. From sacral segment of the sympathetic trunk, can you see here? These two guys.
From sacral.
So,
Sympathetic.
yeah, so here's the sacral segment of the sympathetic trunk running down. You see, it gives you a few branches toward the plexus. Okay? So these are going to be presynaptic sympathetic branches, which you call them as sacral splanchnic nerves. Okay? So sacral splanchnic nerves are sympathetic and presynaptic.
And
All right?
also from S2, 3, 4.
No, that's something else.
Okay.
That's totally different. So, are we good with this? So, sacral splanchnic nerves, they arise from the sacral segment of the sympathetic trunk. Okay? So these are this one here. All right? So, still, their nerve fibers are coming from L1 to L3 segments because
Oh.
because we said L1, L3 is the inferior limit of the cell bodies of the sympathetic nerves. Exactly. So still,
S2 to S4 it's already parasympathetic.
S2 to S4, don't mix it up. It's parasympathetic.
Yes, okay.
All right?
So it just gets another name. It gets a sacral plexus, but it's the
Sacral
continuation of the
splanchnic.
lumbar splanchnic.
No. So sympathetic trunk is coming down. In the abdomen, it gives you lumbar splanchnic nerves. In the pelvis, it gives you sacral
But
splanchnic
it
nerves.
originates
From the lumbar regions, of course.
L1
to L3
But
-ish.
it's continuation of those ones that started in the thorax and the chain, or
So yeah, the thing is, the whole sympathetic trunk, or if you imagine, if this is a spinal cord, let's say,
okay.
cervical region, cervical, thoracic, lumbar, and sacral down here. Okay.
Okay.
So let's say sympathetic nerves, they would be extending between T1 to L, let's say 3 max.
Okay.
Okay? In the cervical region, you don't have any sympathetic nerves to originate cell bodies in the spinal cord, okay? And in the spinal cord of the lower lumbar and even sacral, there is no sympathetic nerve originating. All right? So let's say, let me bring it. Let me bring the drawing somewhere else. There is no space.
You want to add on my drawing?
Yeah, I could do it there.
I will send you you want me to send you like
No,
a
no,
picture?
just open up a thingy.
So I will copy it. Don't go in this one.
Just open a new page.
But then it will not be on your
Oh yeah, so I will do it here then. Wait up. I do something, then I delete that page.
You want that I will send you?
So let's say here is the sympathetic trunk, okay? Sorry, the spinal cord.
Spinal cord.
And next to it in the green color you have the sympathetic trunk with the ganglia, okay? Then let's say here is gonna be the lumbar region. So L1, L2, L3, L4, 5, 1, 2, blah blah blah. So the thing is that the cell bodies of the sympathetic nerves are arising from these regions. Okay? And they make their way to the sympathetic trunk. Okay? So the ones in the lumbar region, of course you know that you have got the abdominal aorta here. So they do nothing here. These presynaptic sympathetic nerves, they do nothing here, they just pass. Which are gonna be the lumbar splanchnic nerves.
Greater, lesser
No, no, no.
No, lumbar.
That, lumbar. So that's the thorax. So these are gonna be lumbar, L, S, N, splanchnic nerves.
Okay.
To form, let's say, the superior hypogastric plexus. Then the aorta divides, let's say, into,
They also but give to the inferior mesenteric ganglion, right?
yeah.
Okay.
So here, let's say you have the ganglion, superior hypogastric, then you have the right and left hypogastric nerves, then they form inferior hypogastric ganglion, as we saw in the picture,
Yes.
okay? So, still, we have the continuation of the sympathetic trunk coming down toward the sacral region, okay? So it means still you have some ganglia in the sacral region, but the thing is that that's my point. Their nerve comes from the lumbar region.
Okay.
They are just descending down, descending down, descending down, and then once you're reaching close to this plexus down here, then some branches are running toward it. So these guys are going to be sacral splanchnic nerves. That's it. So it's not something really complicated.
Can you do the same for sacral plexus?
So sacral, yeah, I would do it. So are we good with this?
Yes.
They're called sacral splanchnic nerves.
Yeah, these are sacral splanchnic nerves.
So they can go here.
and the main difference
and
between
then-
them and the lumbar splanchnic nerves is
That's in the lumbar region. This is in the in the abdomen. Here is in the pelvis.
like they both originate from the
This
same
can go
L2 to
here.
L4.
Yeah.
Or,
Synapse
sorry.
here. It continues to the inferior hypogastric from the superior, right?
Huh?
It continues to the inferior hypogastric plexus from the superior.
Which
or in
ones?
separate branch.
Which-
The lumbar splanchnic.
Lumbar is from superior hypogastric from the abdomen to the pelvis.
And then when it continues to the inferior hypogastric, it can continue to the inferior hypogastric.
Yeah.
So it continue after passing through the superior one, or just directly to the inferior.
So the nerves have to pass through the superior
Okay.
to make their
So
way
they
to the
do-
inferior.
Yeah, that's what I meant. So they have to pass there.
So sacral plexus L4 to S3 is gonna be the sciatic nerve. If you remember sciatic, it was actually formed by two nerves. Remember?
The femoral or posterior.
Tibial
Tibial.
and common
The
fibular.
nerve.
But that's like after it bifurcates, right?
Yeah, it's basically, it's not about bifurcation. Tibial and common fibular nerves are actually, they are the ones to form sciatic.
Okay.
So sciatic, even if you find the bifurcation behind the knee,
You can separate.
if you separate them from each other, it can lead you to the ass.
Even like if you separate them in the
You
thigh
just
region,
yeah,
you can-
just keep them like
Okay.
tilting them apart from each other until you make it to the gluteal region, to the very origination. You can do it. So that's one thing. The next guy, the gluteal nerves. I forgot to tell you. So L4, L5, S1. You have superior gluteal nerve. L5, S1, S2, you have the inferior gluteal nerve. Also, nerve to quadratus femoris and is from L4 to S1. Nerve to obturator internus is from L5 to S2. But you don't need that. Just know the names. All right? So inferior gluteal nerve supplies whom? Gluteus maximus. Some nice memories are coming up from last year. Superior gluteal nerve supplies
Medius and minimus.
gluteus medius
And
minimus and tensor
Fasciolata.
fascia, exactly, latae. Good.
Wait, you said the nerve to quadratus femoris, it's not part of the sacral plexus.
It is.
It is?
Yeah, but just know the names. You don't need to know the originations.
Can you also draw them like?
Okay, no, they didn't talk.
So nerve to quadratus femoris, it should be here. Here it is. So nerve to obturator internus would be the same level, same as inferior gluteal nerve. So I just write it here. Nerve to obturator internus, and then the same level as the nerve to as a supragluteal nerve, you would have nerve to quadratus femoris. Okay, so they are the same level. So I just write them in different color. Now what else? Also from S1 and S2 you get a branch to, or you get a nerve to piriformis muscle. Just know it as nerve to piriformis. I mean, I don't want to make it so.
Make it on the other side.
All right.
Make it the other side, small one.
Also obturator.
Obturator is from lumbar plexus. So
Ah,
L2 to
yeah,
L4.
yeah.
So nerve 2.
Yeah,
Piriformis. All right then.
When they say that it's somatic nerves, it means it is a sacral plexus.
Yeah, yeah. So S2, S3, you're gonna have the posterior cutaneous nerve of the thigh. Okay, and also S2, S3, and S4. They are the ones to give you whom? Pudendal nerve. So these are the major ones that definitely you should know. All right? So that's it. No more. All right then.
send us after that.
Yeah, sure. Let me just take the screen now.
Wait, and how do they run?
Close the side pages.
Usually all of them are getting to the gluteal region through through the greater sciatic foramen. That's the main course.
Greater sciatic foramen being located where? On the pubis or?
No, above the
Between the sacrotuberous ligament.
above the ischial spine. Yeah.
It was the greater sciatic nerves. No, yeah.
Which ligaments we can see in this picture?
Sacrotuberous, sacrospinous, anterior sacroiliac, posterior sacroiliac. Find sacrotuberous and then continue it on the back side. Then you have posterior sacroiliac.
Okay.
Yeah. All right then. So it's pretty much about these guys. Now, again, back to the sympathetic segments of the inferior plexus. So lumbar splanchnic and sacral splanchnic nerves give you the sympathetic nerves. From the other side, we've got the parasympathetic portion, of course. The parasympathetic portion of the nerves of the pelvis comes from, can you see these blue line nerves or blue colored nerves? S2, S3 and S4. You have pelvic splanchnic nerves. So don't mix them up with the sacral.
Yes.
Remember like that: sacral, sympathetic, pelvic, parasympathetic, SSPP. So, pelvic splanchnic nerves, they arise from S2 to S4 segments. As you see, they are arising or they are leaving the anterior sacral foramina. So they have nothing to do with the sympathetic trunk, okay?
Sorry, which are sympathetic and which are
Sacral, sympathetic, SSPP, pelvic splanchnic nerves, parasympathetic. So S2, S3, and S4, these are the guys to give you the pelvic splanchnic nerves.
What do you mean in that they go from the anterior, so they have nothing to do with this?
So basically, again, these guys are arising from the spinal cord levels of S2 to S4.
Okay, and the sympathetic, we say that's the lumbar.
Yeah, sympathetic is related to the sympathetic trunk.
Mm-hmm.
That's the thing.
Okay, no problem.
In this case, parasympathetic is related to the spinal nerves itself.
Okay.
Okay? So check it up here. For example, here you have got the sciatic nerve, this big guy. So here are the, let's say, roots of the sciatic nerve, and then these guys are going to be, the blue ones are going to be pelvic splanchnic nerves. Pelvic splanchnic nerves make their way, or they join the inferior hypogastric plexus. The thing is that sympathetic nerves, they synapse in this plexus down here, all right? But the parasympathetic nerves, do they synapse? No,
In the inferior?
no, they don't synapse.
Okay.
Parasympathetic nerves always synapse in where? In the wall,
In the wall.
in the wall of the organ. So let's say, if I wanna like continue with the drawing, so I make a continuation of the, internal iliac artery, like this. Let's say this is one artery to the, it's just a, let's say, terminal branch to the prostate gland. Okay? This is prostate, for example, okay? The thing is that if this is the artery to supply the prostate gland, so you're gonna have nerves surrounding it, because